Title: What Your Nails Say About Your Health, 7 Warning Signs You Should Never Ignore. Have you ever looked closely at your fingernails and wondered if they were trying to tell you something? Most people think nail changes are simply a normal part of getting older. They blame dry nails, ridges, or discoloration on age and move on without giving them another thought. But doctors know that your fingernails can sometimes reveal important clues about what's happening inside your body long before other symptoms appear. Changes in color, shape, thickness, or texture may be linked to problems involving your heart, lungs, liver, kidneys, blood circulation, or nutritional health. That doesn't mean every unusual nail is a sign of a serious disease. However, ignoring persistent changes could delay the diagnosis of conditions that are much easier to treat when found early. In today's video, you'll discover 7 nail warning signs that every adult over 60 should know what each one may indicate, and when it's time to seek medical advice before a small warning becomes a much bigger problem. Your fingernails are made primarily of keratin, but they also depend on a healthy supply of oxygen, nutrients, and blood circulation to grow normally. Because nails grow slowly, they often record changes in your health over several months rather than days. This is one reason doctors sometimes pay close attention to the appearance of a patient's nails during a physical examination. While blood tests and imaging studies provide detailed information, the nails can offer valuable clues before more obvious symptoms appear. As we age, nail growth naturally slows down. Nails may become thicker, more brittle, and develop mild vertical ridges. These changes are often part of normal aging and usually are not dangerous. However, certain changes are different. When a nail suddenly changes color, develops an unusual shape, becomes separated from the nail bed, or shows dark streaks that were never there before, it deserves closer attention. Many serious health conditions develop quietly over many years. Heart disease may reduce blood flow. Lung disease may reduce oxygen delivery. Liver disease may affect protein production. Kidney disease may alter mineral balance. Vitamin deficiencies may slow healthy nail growth. Because nails grow gradually, they often become one of the first visible places where these problems begin to appear. This is why paying attention to your nails is not about becoming fearful, it is about becoming aware. Learning to recognize unusual nail changes allows you to ask important questions before symptoms become severe. The goal of today's video is not to diagnose disease by looking at your nails alone. Instead, it is to help you recognize warning signs that deserve professional medical evaluation. The earlier certain diseases are detected, the greater the chance of successful treatment, especially after age 60. If you begin noticing a persistent nail change that lasts for several weeks or continues getting worse, do not simply assume it is caused by aging. Sometimes your fingernails are quietly telling a story that the rest of your body has not yet revealed. The first warning sign is a dark line running from the base of the nail to the tip. While some harmless pigment changes become more common with age, a new dark streak that appears on only one nail deserves immediate medical attention. In some cases, it can be an early sign of a rare but serious type of skin cancer called subungual melanoma. Unlike a bruise that gradually grows out with the nail, this type of dark streak often remains in place or slowly becomes wider over time. If the dark color begins spreading into the surrounding skin, do not ignore it. A dermatologist should examine it as soon as possible. The second warning sign is nails that become yellow, thick, and difficult to trim. Many people immediately assume they have a fungal infection, and sometimes they are correct. However, persistent yellow nails can also be associated with chronic lung disease, diabetes, thyroid disorders, or a rare condition called yellow nail syndrome. If the nails continue changing despite treatment for fungus, additional medical evaluation may be necessary. The third warning sign is spoon-shaped nails. Instead of curving gently downward, the center of the nail becomes depressed, almost like a tiny spoon that could hold a drop of water. Doctors call this condition koilonychia. One of its most common causes is iron deficiency anemia. Without enough healthy red blood cells carrying oxygen throughout the body, nail growth becomes weaker and thinner. Many adults over 60 experience chronic iron deficiency because of poor nutrition, digestive disorders, or slow internal bleeding that may not cause obvious symptoms. A simple blood test can often identify this problem early. The fourth warning sign is nails that suddenly become very pale or almost completely white. Healthy nails usually have a light pink color because of the blood flowing underneath the nail bed. When that pink color disappears, it may indicate reduced blood circulation, anemia, liver disease, or low protein levels. Although aging can slightly change nail color, completely pale nails should not be ignored, especially if accompanied by fatigue, dizziness, or shortness of breath. The fifth warning sign is blue or purple nails. This change often means the body is not receiving enough oxygen. Cold temperatures can temporarily cause this appearance, but if blue nails persist even after warming the hands, they may signal heart disease, lung disease, or poor circulation. Because oxygen is essential for every organ, this warning sign should always be evaluated promptly. The sixth warning sign is clubbing. Instead of remaining flat, the fingertips become enlarged and the nails curve dramatically over the ends of the fingers. This process usually develops slowly over several years. Clubbing is commonly associated with chronic lung disease, certain heart conditions, and occasionally digestive disorders. Although not every case is dangerous, it always deserves medical evaluation because it rarely occurs without an underlying cause. The seventh warning sign is nails that suddenly become extremely brittle, cracked, or split despite proper care. Many older adults blame aging alone, but persistent brittle nails may also indicate thyroid disorders, nutritional deficiencies, dehydration, or repeated exposure to harsh chemicals. If simple lifestyle changes fail to improve the nails after several months, your doctor may recommend blood tests to identify the underlying cause. Remember, no single nail change can diagnose a disease. However, persistent changes that continue worsening should never be ignored. Sometimes your fingernails notice a problem long before you do. As we grow older, our fingernails naturally change. They grow more slowly, become drier, and often develop mild vertical ridges. These normal aging changes happen because blood circulation gradually decreases.
The gradual decrease in oxygen saturation leads to a visible change. This is cyanosis.
One of the biggest mistakes many older adults make is assuming that every nail change is simply part of getting older. While some changes are harmless, others deserve medical attention, especially when they appear suddenly, continue getting worse, or affect several nails at the same time. A good rule to remember is this: if a nail change lasts longer than 6 to 8 weeks without improving, or if it continues to spread, it should be evaluated by a healthcare professional. For example, a dark line that becomes wider over time, especially if it appears on only one nail, should never be ignored. Although many dark streaks are harmless, some can be an early sign of melanoma, a serious form of skin cancer. Early diagnosis can make a life-saving difference. Nails that become blue or purple without exposure to cold temperatures also require prompt medical attention. This may indicate that your blood is not carrying enough oxygen, which can happen with heart disease, chronic lung disease, or problems affecting blood circulation. If your nails suddenly become extremely pale, along with unusual tiredness, dizziness, or shortness of breath, your doctor may recommend a complete blood count to check for anemia or other blood disorders. People living with diabetes should pay even closer attention to their fingernails and toenails. Thick, yellow, or infected nails are more than a cosmetic problem. Fungal infections can damage the skin around the nail, allowing bacteria to enter the body. Because diabetes often slows wound healing, even a small infection can become much more serious if left untreated. Persistent spoon-shaped nails may suggest iron deficiency or another nutritional problem. Instead of taking supplements on your own, it is much safer to have blood tests to identify the true cause. Iron supplements are helpful only when iron deficiency is actually present. Taking them unnecessarily may create other health problems. You should also seek medical advice if your nails begin separating from the nail bed, become severely thickened, or develop swelling, redness, warmth, or pus around the edges. These signs may indicate an infection that requires treatment before it spreads deeper into the surrounding tissue. Your doctor may recommend simple tests depending on the changes they observe. These could include blood tests to evaluate iron levels, vitamin deficiencies, thyroid function, blood sugar, liver function, or kidney function. In some situations, you may also be referred to a dermatologist for a closer examination of unusual nail pigmentation or suspicious growths. The important message is not to become anxious every time you notice a small change. Instead, learn to recognize patterns that persist, worsen, or appear together with other symptoms. Paying attention early often leads to earlier diagnosis, simpler treatment, and better long-term health outcomes. Your fingernails cannot tell you exactly what disease you have, but they can provide valuable clues that something inside your body deserves a closer look. Listening to those clues may help you protect your health long before serious complications develop. The good news is that you do not need expensive equipment or medical training to notice important changes in your fingernails. Spending just 5 minutes each week looking at your nails may help you recognize changes that deserve medical attention. Start by examining your nails in bright, natural light whenever possible. Artificial lighting can sometimes make it difficult to notice subtle changes in color. Look at every fingernail one by one. Ask yourself a few simple questions. Has the color changed? Do any nails appear much paler, yellower, or darker than they did a few months ago? Is there a new dark stripe that wasn't there before? Has the shape changed? Are any nails becoming unusually curved, spoon-shaped, or thicker than the others? Next, check the surface of each nail. Aging commonly causes mild vertical ridges, but deep grooves, severe cracking, or sudden roughness that appears over a short period of time deserves closer attention. Pay attention to the skin around your nails as well. Persistent redness, swelling, tenderness, or drainage may indicate an infection that should not be ignored, especially if you have diabetes or poor circulation. Compare both hands. Healthy nails usually look very similar on both sides. If one nail begins changing dramatically while the others remain normal, that difference is often worth discussing with your healthcare provider. Taking a photo of your nails once every month can also be surprisingly helpful. Small changes are difficult to notice from day to day, but comparing photographs over several months makes gradual changes much easier to recognize. Remember that healthy nails begin with healthy habits. Eating enough protein, staying well hydrated, controlling blood sugar, avoiding smoking, and protecting your hands from harsh chemicals all support healthier nail growth. If you notice a change that concerns you, avoid trying to diagnose yourself using information online. Many nail conditions look similar but have completely different causes. The safest approach is to let a qualified healthcare professional determine whether further testing is needed. Most importantly, do not ignore changes simply because you are getting older. Growing older does not mean you should expect every unusual symptom to be normal. Your body often sends quiet signals before serious illness develops. Your fingernails are just one of many places where those signals may appear. Learning to notice them is not about becoming fearful. It is about becoming informed, taking action when necessary, and giving yourself the best opportunity to stay healthy, active, and independent for many years to come. If today's video helped you see your fingernails in a completely different way, we'd love to hear from you. Have you noticed any changes in your nails after turning 60? Share your experience in the comments below. If you found this information helpful, please like this video, subscribe to Healthy After 60, and turn on notifications so you never miss our next evidence-based health guide designed to help you live a healthier life after 60.